So this is X-ray soft tissue neck lateral view showing lower part of the skull, upper part of the chest. Now I'll tell you the normal findings. This is straightening of the cervical vertebra. This is the airway. You can make out the epiglottis. So this is a laryngeal inlet, and this is the airway. So as you go down, notice that the airway is narrowing. This black shadow, radial lucent airway, is getting narrowed. That is because the area between this cervical vertebra, posterior part of this trachea, this part, the prevertebral soft tissue area, is grossly widened. We call this widened when the dimensions of the body of this cervical vertebra, when you compare it with this, when you compare the prevertebral soft tissue shadow, this should not exceed more than half or 2/3 of the width of the body of the cervical vertebra. In this case, this widening is almost more than double the width of the body of the cervical vertebra. Notice also there is a metallic density foreign body, a safety pin which is open and which is downwards. There's also a fluid air level. So this is diagnostic of retropharyngeal abscess. Now we have to note where the foreign body is situated. So we can correlate it with the level of the cervical vertebra. 1, 2, 3, 4, 5, 6. So it is between 5 and 6. It is opposite 5 and 6. So since the esophagus starts at the lower level of the C6 or lower level of cricoid, here the foreign body is said to be situated in the cricopharyngeal region. And so the diagnosis would be foreign body safety pin in the cricopharynx with retropharyngeal abscess. So once again I repeat, this is X-ray soft tissue neck lateral view showing straightening of the cervical vertebra with narrowing of the airway, with prevertebral soft tissue widening, with a metallic density foreign body safety pin with open end facing downwards, with fluid air level. So foreign body is at the level of C5, C6. So my diagnosis would be foreign body safety pin in the cricopharynx with retropharyngeal abscess and also airway narrowing. The management of this condition would be esophagoscopy. Prior to esophagoscopy, we may need to do tracheostomy because the patient's airway is narrowed. While doing a tracheostomy, care should be taken to use a portex or a cuffed tracheostomy tube. So this cuffed tracheostomy tube will help in preventing the aspiration of this abscess in case it ruptures. And we have to drain the abscess by making the patient lie down in a supine position with the head end facing downwards, so that the patient so that you can prevent aspiration. So avoid doing this surgery in general anesthesia because putting an endotracheal tube may cause the abscess to rupture and aspiration of the secretions into the lungs. So adequate suction, adequate light should be available, and you may aspirate the secretions with a wide bore needle if possible, and then do a formal incision and drainage, and then do a esophagoscopy or hypopharyngoscopy, remove the foreign body, put a Ryle's tube. So once again, X-ray soft tissue neck lateral view showing straightening of the cervical vertebra, widening of the prevertebral soft tissue area with a foreign body safety pin with fluid air level and airway narrowing. So foreign body safety pin in the cricopharynx with retropharyngeal abscess and airway narrowing. So treatment would be tracheostomy with the cuffed tracheostomy, non-metallic tracheostomy tube with incision and drainage of the abscess. That is, it should be done through oral cavity route, and also hypopharyngoscopy or esophagoscopy and foreign body removal.